Hi there, I'm Richard Morris with the PAL Metabolic Program. I'm excited to be here today with Dr. Amit Patel in Scottsdale, Arizona. Dr. Patel is board certified in pain medicine and anesthesiology. He is also a graduate of, is it John Hopkins Hospital?
Johns Hopkins Hospital and the Mayo Clinic.
And the Mayo Clinic, wow. Now, Doc, where did you go to school?
So we've been kind of all around the country. My wife and I grew up in Oklahoma, and I did my undergrad in medical school at the University of Oklahoma.
Okay.
After that, we went to internship at Michigan, and Baltimore after that for Johns Hopkins, and then Arizona and Rochester for the Mayo Clinic. So kind of all around the U.S.
Wow.
We love Scottsdale, and so we settled down over here.
Okay. Well, we're honored to have you.
Oh, thank you.
Yes, and now Dr. Patel is a special doctor, and the reason I say that is because I had an opportunity to meet him for the first time not too long ago, and what it really stood out to me is, he's a sharp guy. He's been through some really extensive schooling and actually graduated at the top of his class. But even more than that, it was his compassion and his dynamic way of treating patients with the whole wellness really spectrum when it comes to that patient treatment. So I want to talk to you a little bit about that wellness approach that you have.
Definitely.
You know, what's really fascinating to me is just this pain management industry. And you see so many people just being loaded up on pill after pill after pill. And really, it's like this vicious cycle. I mean, what is your perception, your thoughts on all this?
Well, I think it started from a good place. In the 90s, we thought that pain was another vital sign. So anybody that reported a pain score of 8, 9, or 10, the answer was always throw more pain pills at them, and that'll take care of the problem. We found over time that pain pills can sometimes cause more trouble than what they actually cure with any kind of pain control. Now, there are good purposes for pain pills for temporary benefit, helping out with pain that's acute, while we're working on actually treating the problem. And some people may chronically be on pain pills for a long period of time, but we try to minimize the amount of opioid or narcotic medication. It has a lot of negative side effects on the hormones, on the activity levels, on the emotional states of the patients. So we found that just throwing a lot of narcotic or opioid medications is not always the answer. And there's a lot of other treatment modalities we can use to strengthen the patient and treat the actual cause of their pain, and overall have them live a happier, healthier lifestyle.
That's really fascinating, you know. And one thing that you mentioned that I want to touch on is you talked about the hormonal side and the emotional side of these pain medications. So talk to me just a little bit more about those 2 points specifically.
Definitely, with opioids and narcotic medications, which sometimes have a place of long-term use in medicine. They do lead to some negative side effects, such as coping mechanisms. Anytime people feel that they're in pain or uncomfortable or even emotionally uncomfortable, sometimes they'll lead to using other medications inappropriately, what we term chemical coping. Rather than chemical coping, there's a lot more healthy lifestyle alternatives. It can be exercise, it can be talking to somebody that's close to you to deal with the problem directly. There's many healthy coping mechanisms that we can use in alternatives to the pills, such as Xanax or taking a Percocet for pain whenever really the pain may be something that you can treat with physical activity and healthy lifestyles and things of that nature.
It's so interesting that you mentioned this. I'm not a pain pill guy at all. But I go back a few years ago and I get a headache and I take 2 Advil. And now I'm taking 3 Advil. And if it's really bad, now I'm taking 4, which is a very light example of, the heavier pain medications.
That's true. And kind of going back to that earlier example, in the 90s, a lot of patients were escalated due to this phenomenon we call tolerance. That if you take 5 milligrams of a certain pain pill for a certain period of time, it helps at first, and then it stops helping. So we go to the 7.5, which helps, and then a couple of weeks later, maybe the 10, and they got up to 30, 50, 100 milligram daily doses of oxycodone, which it's so excessive. And again, you get all those negative side effects, the emotional, the hormonal side effects. There is a side effect called opioid-induced hyperalgesia, which is actually the brain turning up the pain signal because we keep trying to beat it down with these narcotic painkillers, and the brain just keeps turning the pain signal up. So
wow.
In the end, you end up worse than when you were in the first place.
Wow. So talk to me about, I just can't get over really the trap that is, you know? So, talk to me about what makes you a different pain doc than maybe some of the other pain docs who just turn so much to the pills, for that solution.
Definitely. We try to treat the patient as a whole, and that's become cliche in a way, but we really do try to treat the patient's physical state. If they're obese, we try to get them healthy and take the weight off of the lumbar spine and the joints, and we try to help with healthy eating by referring to places like the Patel Metabolic Program. Healthy lifestyle has a lot to do with it. Emotional state has a lot to do with it. So if they have a lot of psychological overlay and they're using the pain pills to treat something that may not necessarily be due to their anatomy, and it's more of a mental issue, we definitely try to get them the help they need. There's a lot of minimally invasive procedures that we use now in conjunction with therapy and physical modalities that actually treat the problem itself rather than cover it up. Things that are just on the horizon, like stem cell treatments to regenerate tissue in the area. Patients that have been put on very high doses of narcotics, we can use things like ketamine infusions to try to reset the pain receptors in the body so that we are able to come down on those narcotics over time. So there's a lot of new cutting-edge stuff that really helps to treat the problem itself rather than throw more pills at it.
Wow, that is incredible. And one thing you said to me that just caught my attention, obviously, was speaking about that obese population that you see. Mm-hmm. So out of everybody that comes to see you, all your patients that come in for pain specifically, is there a percentage or a certain amount of those people who are coming in for that pain, and as their doc, look, this is really the root of this is the weight.
Definitely, and a lot of times that's what it is, especially in younger patients that haven't had the time to actually develop the horrible osteoarthritis that's going to cause chronic pain. Young 20, 30-somethings often come into the clinic, and most of their pain is really due to morbid obesity. And if we can treat that, we can get them off the pain pills, we can prevent diabetes, hypertension, all of these chronic illnesses, and get them living a healthy lifestyle. Scottsdale is a very health-conscious area, so it may be even lower as far as the percentage of patients that are coming here that are obese, but still possibly about 50% of the patients come in with pain related to their morbid obesity over here.
Mm-hmm. So I'm a patient. I come in, I'm overweight. My back's been killing me. Maybe I suffer from migraines. Mm-hmm. And you're looking at me and it's just, maybe I just want my pain pills. Mm-hmm. What is your advice to me in a nutshell?
Definitely. You have to make sure that the patient is ready for it. If you talk to a patient and they are just not wanting to have anything other than pain pills and you say, well, you got to get fit, you got to lose weight, you got to eat healthy, they're just going to shut down. It's a process. We have to learn what each other's comfort zone is. We have to gain trust between the patient and the doctor. And whenever that happens, people will become receptive to these ideas that, maybe it's not just the pain pills. Maybe it's not just going to be a shot that helps out, or it's not going to be a surgery that helps out. It's going to be the lifestyle changes. The changes in eating, the changes in activity, the overall emotional state of the patient may need to change. Mm-hmm. And whenever we do that, a lot of times people make great strides without having to cut on the patient, without having to dope the patient up or resort to other things that may be causing more harm than good.
I keep hearing you go back to this emotional side of things. Mm-hmm. And honestly, I rarely hear that when connecting with a doc, really that emotional link to things.
Definitely. Pain is regulated by the central nervous system, as are emotions. And, whenever patients are feeling pain, a lot of times they feel helplessness and they feel depression and they have an overall attitude that things are not going to get better. When we can get the patient to see that there are alternatives and there are things we can do to get the patient healthy and active and happy again, that's really a process that involves both the physical anatomy and the mental state and the central nervous system just rewiring and becoming less painful, and you don't have that psychological overlay of feeling that the pain is going to constantly rule your life and you're a victim of the pain. A lot of times the patients, when they figure out that they can be active, they can get healthy, they can lose weight, they have friends, they're emotionally going to get more stable, and then they may actually enjoy being active and enjoy being fit, and you make friends that way, and overall you build a community and just change your lifestyle.
I told you he was an amazing doctor. This is just an incredible interview. I'm gathering so much from this, and the connection and the passion that I'm feeling from you from what you talked about at the beginning, like the holistic approach, like the whole wellness approach. And you mentioned earlier, and I wanted to bring it up, but you already hit on it. Was so for these folks in pain, you have them go out and exercise.
Definitely. Now, if it's an extreme example and they have critical spinal stenosis, I'm not going to go and tell them to lift weights. But within reason, activity is very healthy for the patients, not only physically but mentally as well. And it's not only helping their pain state and their emotional state, but again, it's preparing them for a healthy life of avoiding hypertension, diabetes, stroke risk, all of these bad things that come along with obesity and a sedentary lifestyle.
Let's talk for just a second about... I'm going to stop for a second. Okay, so let's talk for a second about the procedures that you do. You mentioned one earlier that caught my attention because I've heard of it before, and that was the stem cell treatments. And I want to have you just touch on that for a little bit. And along with that, talk to me about what the most, I guess, your most coveted or your favorite procedure or treatment to do with patients in the office here.
Definitely. Stem cell treatments are very new, and there's still a lot of research going on. And with the stem cells, the idea is that it's a totipotent cell, meaning that it's a cell that can be molded into any type of cell in the body. Whenever we have cellular injury in an area, say a knee or a shoulder, and the cells that make up the ligaments, the cartilage, the connective tissue in the area are injured and causing pain and reducing the function of that joint, the idea is that we can put some stem cells in the area that can turn into the surrounding connective tissue and help it heal. Initially, I was very skeptical on the whole process of the stem cells, as you don't know what you're getting. And so we've tried to stick to a select number of vendors that are very reputable, and you know that you're getting a high-quality stem cell treatment, and not just something that may be put into a vial of a low quality and not going to benefit the patient. The patients really were excited about the therapy. I was perhaps a little bit more reserved and underselling the therapy because it is newer, and with newer things, it's hit or miss. With the patients we've done so far, which involve anybody from elderly patients to athletes, we've done a lot of knees, shoulders, even parts of the back that are amenable to this therapy. That we've had outstanding results. So it's very exciting. I think it shows a lot of promise for the future. And again, it's actually healing the source of the pain rather than covering it up. And it's not going to be something that we have to do over and over, and then eventually the treatment will stop working, or we have to escalate doses of drugs and we end up worse than we were in the first place.
That sounds awesome. I actually I didn't know quite as much about it as you just shared, so I appreciate the knowledge. And for our viewers from home, let's just say I'm at home. I'm suffering from pain right now. Maybe I'm caught in the pain pill trap, whatever we want to call it. And whether they come in to see you or not, what advice do you have for someone at home who's just in pain? Something they can do now to start supporting them.
Definitely, my advice would be to see a medical professional early on, before the pain actually gets to the point where it's controlling your lifestyle. You don't want to leave the house. You become sedentary, and everything else goes downhill, including your personal relationships. And if we could catch it early on, let's say after an acute injury, and it's just not healing up like it should, usually there's things we can do to reverse some of that damage, maybe kill off the inflammation, certain types of therapy and physical things that we can do, and lifestyle changes that can really reverse that before it becomes something that takes control of somebody's life. So early treatment, I think, would be the best thing for these chronic pain states before it becomes something where you come into the office and it's been something that's going on for 10 years, and the chances of really significant, meaningful turnaround of that are lower than if it was just right after the acute injury and we treated it properly.
Okay. And let's just say that I'm not in that state where it's early in the injury, and let's just say I'm deep into this thing, and I haven't seek that advice, early on, and maybe I feel like it's maybe too late for me. Where do I turn? What do I do?
There's always something that we can do. There's patients that have had numerous back surgeries that have failed, and they're, as a result, in chronic pain 24/7. There's significant nerve damage that's been done. Even with those patients, there's things that we can do to modulate the nervous system to decrease that pain signal overall. There may not always be 100% relief of the pain, but if we can take care of the majority of the pain and get the patient active again and living their life like they want to, that's the goal. And even with pain that's been going on for decades even, we can help that out and get it significantly better. It may be unrealistic to say that we're going to take care of 100% of it when it's been going on for decades, but we can take care of a lot of it, if not the majority of it.
Sounds great, Doc. This has been awesome meeting with you, Dr. Patel. We have a few fun questions that we like to end with. First question I have for you is, what do you love most about being a doc, and specifically a pain doc?
Well, I really like the patient interactions. Whenever you see a patient come in and they're really not in a good place, and you see them on subsequent visits, and you're working and you're making progress together, and then one day the patient comes to you and they're like, "Doc, remember what a mess I was when I came in?" And they're feeling good, they're active with their friends and their family, and they really kind of take control of their life again, and that's kind of the most gratifying thing in medicine. It's just something you can't really put a price on, because whenever you give somebody back that joy of living, there's no greater gift.
Absolutely. And so it becomes less of a job and more of like a passion.
Exactly.
Something you love doing. So speaking of the job or the passion, how many hours a week do you spend in the office?
Usually we're here about 50 to 55, which is fairly reasonable.
Yeah.
It's not horrible hours. A lot of doctors work a lot longer, so I find that it's enough time to enjoy your personal life and balance it with your work life and service the patients and keep them happy. Speaking
of your personal life, I know you're a brand new father of a little girl.
Yes. Yep, first child that we've had, so a very nice new experience, and the wife and I are just getting past that stage where the baby's crying, and we're enjoying the baby a lot more during the day and sleeping through the night. And every day, she grows more and more, and does something new, and it's just something exciting every day after work to go home to that and really kind of enjoy watching your child grow up before your eyes.
It's incredible. And I just found out today that Dr. Patel and I have a baby that's just a week apart.
Exactly. Yeah. Although you're a little bit more experienced than I am. This is number 4?
Number 4 for me.
Oh, wow. Yeah. So I could probably use a few pointers on that from you.
Hey, but you know what? A girl is worth all 4 combined. So
I'll take your word.
You got your hands full. All right. Again, thank you, Dr. Patel, for sitting down with us today. It was an honor to get to know you better. And again, if you're out there and you're looking for some support in this area, here's your man, Dr. Amit Patel in Scottsdale, Arizona.
Awesome.
Thanks for watching.
Thank you.